Joining us from Capitol Hill, we have Democratic Senator Michael Bennet. Thanks for taking the time.
Thanks for letting me come on.
So have you talked to Senator Gardner in the last couple of days? Because we haven't been able to ask him questions about all this.
I have not talked to him in the last day or so.
Okay. With that being said, now that we've seen this particular repeal and replace effort fail, where is the Democratic plan? Because Democrats have been talking about fixing Obamacare for a long time. Why not have a big kickoff for that?
Well, for one thing, I think we should stop talking about Obamacare and start talking about the healthcare system that we have in this country. And there are plenty of us that have bills with Republicans and other Democrats that would help fix our healthcare system and make it better, make it more transparent, make it more affordable, create more competition in the system. And I think we should be going to work on those bills. And even beyond what Michael Bennet or the Democrats would want, I'd like to see us have committee hearings and invite the American people to testify in Congress about what they want out of a healthcare system.
That being said, we had weeks to chew over the Republicans'
We've had this
Go ahead.
Sorry, what were you saying? Go ahead, you go ahead.
No, I was saying we've had a few weeks now to chew over different iterations of the Republican plan to tweak Obamacare. Is there any piece that you saw out of the Republican proposals that you think could be included in a bipartisan solution?
I actually don't think so, because this bill, and Brandon, you know me, I work in a bipartisan way all the time. This bill was soundly rejected, not just by Democrats in our home states, but by Republicans in our home states. If you asked me to set out to write a bill less responsive to the critics of Obamacare, to say nothing of the supporters in Colorado, I could not write a bill less responsive than the bill the Republican majority has been working on. So I think we should start from scratch, and I think we should start with what the American people have to say about the healthcare system, not what people in Congress have to say about it, or least of all, people in think tanks in Washington, D.C. that have absolutely no idea what people are facing every day.
At McConnell's press conference, we did see Cory Gardner show up there, and he warned against Democrats spiking the football. He pointed specifically to those new numbers out of Colorado showing a 27% average increase in premiums on the individual market in Colorado. We talked about that all the way back in your debate when you were running for re-election. I mean, what is it going to take to get a handle on these premiums going up for people on the individual market each year?
I think that we're going to need much more competition in our health insurance system than we presently have. I think we need far more transparency than we have. Right now, we're in a system where anybody can raise their rates in healthcare, and nobody knows what anything really costs. That's ridiculous, and that shouldn't be anybody's business plan, but it's the business plan of too many insurance companies in this country. I think that Medicare ought to have the right to negotiate for drug prices on behalf of the American people. We don't have that in our system. I mean, there are a billion things we could do. But the idea that a majority of a party that has the presidency, a majority in the Senate, and a majority of the House would say that somehow double-digit increases in insurance companies are the other party's fault when they haven't passed a piece of legislation with their majorities, I think is absolutely outrageous.
You say you want to,
that's not what he meant.
You say you want to inject more competition. Republicans will say ever since Obamacare, we've seen less competition because it's priced some people out of the individual market, priced some companies out. They just don't want to do business on the exchanges. So how do you foster more competition now?
I know. First of all, I know they say that. That doesn't make it true. We've had these issues before the Affordable Care Act was passed, and those of us that worked on the Affordable Care Act predicted that we'd have some of these issues, and we've had them. And I'm not an expert in insurance, but for instance, you could change the way we draw the pools so that people weren't restricted to buying insurance in one small county, but might be aggregated over a larger number of people. You could imagine a world where people could buy into Medicare or buy into Medicaid. You could imagine a world where there were a public option made available for people. You could imagine a world where we had nonprofit co-ops which we did have as part of the Affordable Care Act until they were defunded by the opponents of the Affordable Care Act, who then blamed the Affordable Care Act for their failure. I mean, what we could have is a rational, non-political conversation about health care, and that might amaze us at the progress we could make. It's staggering how inefficient our healthcare system is. We spend 16% or so of our gross domestic product on healthcare, when every other industrialized country in this world spends half that or less than half that on healthcare.
Last thing I got for you, I mean, it would be easy to put this problem on the Republican shoulders because, as you point out, they do control all the levers of government right now. But what would you say to someone in the middle who feels like both parties are talking past each other? Where's the leadership from your side on this issue?
Well, I think we provided some leadership when we passed a bill that said that insurance companies couldn't throw you off your insurance because you had pre-existing conditions. We showed some leadership when we passed a bill that said insurance companies can't throw you off insurance just because you hit some lifetime cap if you get cancer. We tried to show some leadership by expanding Medicaid to cover more poor people in our states that weren't covered, even though they were working, many of them, in the United States of America. Now, what we need to do is come together and work in a bipartisan way. We should have committee hearings in regular order and have the American people come and testify in this body what they would like out of their healthcare system. That's what we should have. And I think that they're sick and tired, whether the Democrats, Republicans, or as you described it, people in the middle of a my way or the highway approach that might get people elected but doesn't do anything to actually change the healthcare system. I think what's particularly cynical about what Mitch McConnell has done here is that they voted to repeal the Affordable Care Act 60 times, I think, or more in the House of Representatives. They voted to repeal it in 2015 in the Senate. They actually sent a bill to the President Obama, who vetoed it. They said that you should vote for us because Obamacare is destroying the country. And they said they couldn't get it done when they had the House. They couldn't get it done when they had the House and Senate. So they said, send us a president. Now they have the House, Senate, and president. And it turns out that all the falsehoods that they talked about caught up to them. And they weren't even able to bring their bill for a vote on the floor. And I've said all along this should be a bipartisan process, and I hope that after all of this, Mitch McConnell believes that as well.
Senator Michael Bennet, Democrat of Colorado, thanks so much for taking the time. We appreciate it.
Thanks for having me. I appreciate it.